Bloom Again provides a bridge really between the poverty and health. That's really what we want to do. We want to get working women back on their feet, back to work. These are proud women who don't want to take a handout. So what we really do is we lend them a hand up. We help them in ways that get them back to work, back on their feet.
Many of them are single parents. Many of them find themselves, the sole provider, and they have these little mouths to feed and these little faces looking at them like, what are we gonna do, Mom? When Mom gets sick, that devastates the household. So anything that we can do to really help them get back up on their feet, we're not just helping the woman. It's always children involved. It's always families involved.
At the age of 37, I was suddenly a cancer patient, and life just pretty much changed overnight. I had to resign from my job as a flight attendant shortly after my diagnosis. I actually called one of the social workers at Huntington Hospital, and she told me that there was a foundation that offered help for people who had medical emergencies as well as financial emergencies, because what I found was several of the foundations out there, they don't offer monetary assistance. They'll offer, maybe rides to and from treatment, or they'll offer you help with your prescriptions, but I actually needed money to help me get a place to live.
We set ourselves apart because we're rapid response. We can respond within 24 to 48 hours of receiving a request from one of our community partners. And that sets us apart, because when you have a need, you kind of need the money now. You don't need the money 6 weeks from now after all the paperwork get processed.
What makes Bloom Again special is that it is a vision of one woman who had gone through her own personal battle with cancer. And from that experience of, I cannot imagine how she must have felt having to live through that. She used it as an opportunity to give back and to really connect with other women.
Lois came to me. She made an appointment to come and see me and to tell us about this foundation. And when she asked if we thought there would be a need for such a foundation, I said absolutely, because what she was talking about is trying to help women who have medical emergencies get back on their feet, basically to bloom again after a medical emergency, either for themselves or for a family member, and they therefore lose income because of caring for a sick family member. So I said, Lois, all kinds of women fit that bill for us. I think it's a huge need.
My brother-in-law was out one day, was hanging out with the wrong people, and he got beat up. Got home like that, and we had to take him directly to the hospital. Turns out he had a brain hemorrhage, and they had to stop the bleeding. So I had to stay in the hospital with them just to communicate, since I'm the only one who speaks English. And what ended up happening is I got laid off because I took too much time off of work for that emergency.
I think this mission is absolutely valid. It's helping women who are the leaders and the safety nets of their community, of their families, and of communities like ours, low-income communities. It helps them, so therefore it helps a larger network of people. That's a wonderful mission.
I talked to Father Scott, and he and Bloom Again Foundation helped me out to pay my rent, which I think is a blessing from God, that there's foundations like that out there that help people in need, not only in need, but for emergencies like this. And I don't know where I would be right now. I would probably be homeless with my daughter and my husband. Thanks to them, I have a roof over my head. I can't ever thank them for their help. I'm forever in debt with them.
To have a partnership with Bloom Again allows us to expand the services that we can provide to cancer survivors. Recognizing that Bloom Again is a volunteer organization, Celebrate Life is volunteer, but without the people, we can't make this happen.
We work with the strategic partners, who are the people throughout the community that may work for some sort of either a hospital, or they work for some sort of community organization that helps people in need. And so they help us vet through the candidates for the financial help.
What I like about Bloom Again is seeing exactly where the money are going. When you give the money to Bloom Again, you see the actual person who the money is given to, and you get to hear their personal story, and you know that this is an organization that gives directly to the specific need.
I think our community overlooks and marginalizes women who work very hard and do tasks for us often that nobody else wants to do. They're the women who clean our homes, clean our hotel rooms, give us our fast food over the counter. And for these women, even one missed day of work makes the difference between being able to put food on the table or not, being able to pay the rent or not.
My husband, he was diagnosed third-stage cancer, colorectal.
Carmen and her husband are both entrepreneurs, and his cancer actually came back. And when it came back, there were some struggles over, trying to keep the income coming in, and they were actually in a position where their house note needed to be paid.
She says there's an organization that assists cancer survivors and their families in times of need. And if this works, they will send you money to pay your rent. And in 2 days, because my landlord he had come by my house, he had come by my office, he had texted me, and I'm trying to stave him off. And she sent me the email that said, "We are going to be sending you a check for the entire amount of your rent." And it was an answer to my prayer.
Once I settled my workers' comp case, and I was on my feet a lot better than I had been in the last few years, one of the first foundations I wanted to give a donation to was Bloom Again. And it was because I'd had such a personal experience with them, and I realized that every donation that comes in is what contributes to other needy women. So I was able to give a small donation, which I hoped was able to help a woman in a similar circumstance to mine.
Now there's this building up, like I can help somebody too. And when you find yourself in a position where you're doing the helping, it makes you feel like maybe I'm not so bad off after all. Maybe there is hope. There's hope.